Our next speaker is Dr. Heather Stuart, who has a joint appointment in the School of Rehabilitation Sciences and Psychiatry at Queen's University in Kingston, Ontario. So she came all the way from Kingston to be with us this evening, for which we are very grateful.
Thanks, Sarah. So I want to build on some of what Rob has said and just point out that when we talk to people who have experienced mental illness and their family members, through surveys or through qualitative data, what we find is they often identify the media as one of the most significant sources of stigmatizing stereotypes and views. And they find it hurtful. And when we talk about what should we do about stigma in your community, most of the time the first thing that people will tell us is that you need to do something about the media. We want them to stop denigrating us. And I thought what I'd do is just give you a little bit of an idea of how complex I think this problem really is, and that it's not quite so easy as just getting the media to tell us some good news about people who have mental health problems. So my understanding of stigma is that it's a very complex social process, and it evolves on different levels, and all of these levels connect and intertwine. So let's think about it from the perspective of the person who has a mental illness. From the time you're 3 or 4 years old and you've been watching television cartoons, 80% of which highlight disturbed and unusual behavior and associate it with derogatory names and comments. Think of Looney Tunes, for example. By the time you're 3 or 4 years old, you're already starting to absorb your cultural stereotypes. And we've had children as young as 5 draw pictures of psychiatrists for us, and they can do it. We've got one that's got a brainwashing. You're already starting to see the beginning of these negative stereotypes. So when you're in an adolescent in your high school years and you start to have symptoms of a mental illness, you know exactly how people are going to treat you because you've been watching TV for years. You know exactly what the cultural stereotypes are, and you know what's going to happen to you if you disclose. You're going to be teased, you're going to be bullied, you're going to be labeled, and you're going to be excluded from your social group. And at some point in time, people start to begin to accept those stereotypes and internalize them. And we call that self-stigma. It doesn't happen to everybody, but we think it happens to many people. And once you start to self-stigmatize, you expect to be stigmatized wherever you go, and you start to withdraw socially. So you might not apply for a job, for example, because you'll expect that your employer won't hire you and you don't want to disclose. So it has really serious psychosocial consequences for the person. And they're absorbing these concepts and stereotypes from not only news media, but entertainment media, cartoons. So at the next level, let's think about you and I in our interpersonal relationships. So this is kind of the social or the group level. Well, we all have grown up in the same cultures. We know exactly what the stereotypes are. And because of some of the things that we've seen in the media, news and entertainment, we exaggerate the risk. Rob has already discussed this. We exaggerate the risk of violence. At the heart, we think that people who have a mental illness are dangerous and unpredictable, and we probably are afraid to be around them, so we exclude them from our social interactions. And then go up a level again and think about how social structures work. Organizations can set their policies, our laws in the country up so that they can exclude people who have mental illnesses. Or they can keep them in cycles of poverty and disadvantagement. If you think about some of the disability payment systems that you may have in this province, I know in Ontario they're very difficult for people with mental illness to get into. So there's a structural level of stigma. So we did a study a few years ago where we tried to create positive news, and we worked with a reporter, an editor, and we were able to create a lot of positive news. The only problem was the negative news grew at a faster rate than our positive news, and there was no way to stop it, because when you turn on the TV at night, you're getting film footage from places like Japan or the United States or Winnipeg, where you're seeing very graphic images. And even when a reporter goes out of his or her way to present that in a balanced, responsible manner, you have this other mosaic in the background of your mind, this cultural scaffolding that has all of these stigmatized images And I wonder sometimes if that responsible reporting just doesn't give credence to some of those really sensationalized and scary images that you have in your head. And so I think when we're thinking about how to solve the problem of media reporting, we don't just want to focus on the news media. We want to think about entertainment media, and we want to remember that people aren't coming tabula rasa with a blank slate. They're coming already with preconceptions and stereotypes in their mind, and they will selectively pick and choose information to support their own prejudices and stereotypes. So it's the don't confuse me with the facts kind of model. So I think it's not quite as easy when we're thinking of solutions as to say, all we need is more responsible reporting. I think we need much more than that, and we need to think about this at the individual level for the person, the social level, and the structural level. I do think, though, that we need to think more strongly about how to make allies with journalists and reporters and entertainment media. We have an example in Australia where the mental health community worked with a local soap opera, and they introduced a character. He was a very famous character. They had millions of viewers, and they introduced the character to have schizophrenia. So over the course of 3 months, this character, a young man, had schizophrenia. They went through the whole process with him, and they saw him recover on the soap opera and resume a normal life. And I think that's a really good example of how we can think creatively and out of the box, working with our entertainment media, working with reporters, and think about, as well as responsible reporting, but thinking about perhaps encouraging reporters to develop their own guidelines. In some countries, we kind of mental health people make the guidelines here, have our guidelines, but I don't think that works either. I think that's just a veiled form of censorship. And I think we have to rely on our colleagues to think about their own standards of reporting and how they might want to do that. And I think too often the mental health community points fingers and blames the media, the news media, and I think we have to stop doing that. As I said, it's a very complex problem we have on our hands. It's very difficult to solve the issue of stigma and discrimination. It's a human rights issue, and we need to think about ways of building bridges between community groups, between our local media, between our entertainment media, and if we all start trying to think about working in the same direction, I think that we can, perhaps our grandchildren maybe, or our children will be able to say that they have a place in society where they don't have to fear if they have a mental illness. They don't have to fear that they're going to be teased or bullied or passed over for a job promotion or have unstable or unsafe housing or end up in jail, because that's where most people who have serious illnesses go today. So I think I'll just leave the comments there, and I'd be really interested to hear your ideas later on in the discussion period about how we might be able to do some anti-stigma work that would have impact on the way media messages are transmitted. And thank you for your attention.